Good morning, everyone, and welcome to the Knowledge Exchange series hosted by the Waterloo Wellington Older Adult Strategy. This is the first in our four-part series celebrating Seniors Month this June. And today we're happy to talk a little bit about the background and the implementation of the knowledge of the Waterloo Wellington Older Adult Strategy to date. Today's session is being recorded, and please be aware that no one can see your face and your lines have all been muted, so we can't hear you either. So we'd ask that as you engage during this session, that you please share your questions and comments in the question and answer section. I'm delighted to be joined today by two special guests. My name is Don Wildfong. I'm the implementation facilitator for the Waterloo Wellington Older Adult Strategy, and I'll be your host. I'll be joined today by my colleague Jane McKinnon Wilson, who many of you will know as the Geriatric System Coordinator for Waterloo Wellington and a co-lead on the Waterloo Wellington Older Adult Strategy. We're also joined today in the background by our colleague Giselle Loyola, who's helping us with the technical matters. And finally, and certainly last but not least, is our special guest we're welcoming today, Liz McKinnon. Liz is the former chair of the Patient and Family Advisory Committee of the Waterloo Wellington Local Health Integration Network. She's a current participant and member of the Ontario Health West Patient and Family Advisory Committee that is chaired by Matt Anderson. She is a member of the steering committee for the Guelph Wellington Ontario Health Team. And we're delighted that she has served as a longtime champion for the Waterloo Wellington Older Adult Strategy, serving as the inaugural community member on our reference group during our development phase. We're delighted that you've all joined us today. I know that many of you are involved or have been involved in some way in the work of the strategy over the course of the last 3 years, and we're delighted to have you here. I also know that there are many of you who might be new to the strategy and are looking to learn more about what it is and what the work is all about. So we're hoping to take you through that today. So without further ado, we'll begin by sharing what we're hoping to achieve today in this webinar. We're hoping to provide feedback on the origin and evolution of the Waterloo Wellington Older Adult Strategy and introduce our Phase 2 action agenda, our priorities and initiatives that we'll work on throughout the course of the next year. We'll also share updates on the implementation progress to date and present opportunities for those interested in becoming more involved in the work as we move forward. And there are always opportunities. So by way of background, the Waterloo Wellington Older Adult Strategy was developed in 2018 with funding from the Waterloo Wellington Local Health Integration Network. It was the Research Institute for Aging that was asked to lead the development of the strategy, and I was asked by them to work on that project. So that took place between the end of January and the end of October in 2018. It was guided by an advisory committee that was chaired by David Wormold from St. Joe's Health Centre, Guelph, and Karen Lumsden from the LIN. We also had, as part of that development work, a multi-stakeholder reference group. So the beauty of the work we've done to date is that it crosses sectors. It's not about healthcare delivery necessarily. It's also about those community services and supports that are so important to keep older adults safe and well and healthy at home and to promote healthy aging. So over the course of the development, we engaged in over 25 focused dialogues with different groups that would have particular interests and ideas and needs and preferences. We engaged in an environmental scan, conducted some surveys, key informant interviews, and a series of validation exercises. Throughout the development, we completed 2 reports. Report 1 was the strategic pillars, propositional statements, and key enablers that would support the strategic framework, which we articulated in Report 2. These reports can be viewed by accessing the link that's on the screen. I should mention at this point, you'll all receive a copy of this presentation in a PDF format following today's presentation. So where did we land at the end of 2018 as we moved forward with the development? Well, we landed on a 10-year framework that was envisioned as a plan to optimize the health of people as they age in Waterloo Wellington and strengthen the systems and services that support them and their needs, that support them, their families, and their caregivers. So you can see along the bottom, we have a series of key enablers in green, that would be important to help ensure a successful implementation of this new strategy. And we also have some priority pillars that emerged. This was report 1 that I mentioned, the bottom segment of your screen. So we were able to validate those and use those as the structural framework for the strategy that rests above. So these were the 6 goals that were contained in the older adult strategy. And they relate to creating age-friendly societies and communities, how we work together as a community to support healthy aging across and throughout the lifespan. The next 3 goals, goals 3 to 5, really speak to the health system itself, the capacity of the health system, the extent to which we collaborate and coordinate to support well-being and quality of life. And then finally, goal 5 in the health system stream is really related to all dimensions of quality and how do we move to ensure that members of our community are receiving the highest quality of care, services, and supports as they age. Finally, it was important to acknowledge the importance of empowerment and how the strategy might be able to serve as an enabler for the empowerment of people as they age, their caregivers, and the health and social service providers they rely upon. And we call that the triad of empowerment. I'll now turn it over to Jane to talk a little bit about our year 1 implementation.
Thanks, Dawn. So maybe if we can go to the next slide there for the implementation of year 1. So this is really truly a health system transformation agenda. And we've really worked in working closely with the Ontario health teams and really looking at various opportunities for engagement, aligning the older adult strategy with the work of the old Ontario health teams. And in addition, really looked at the value of the adoption of the quadruple aim and recognizing that it's imperative of how we strengthen the performance and how to optimize the health of people, communities, and populations. Throughout the work, we've really also strived to recognize the differences between rural and urban and look at availability of service, access to service, what is unique to each area right across our region, inclusive of Waterloo, Wellington. So an area within Cambridge may look very different from an area in North Wellington. Through this work, we started out with work streams, and we had working groups within each work stream. We had 3 work streams, A, B, and C. And within those work streams, we had co-chairs and members from across our community, inclusive of older adults, community support services, specialized geriatric services, paramedics, right, engaging many partners. We worked with our co-chair committee. We would meet regularly and identify where we were overlapping in certain areas and where we were learning from our members of the work we were doing, and then fed this back into the steering committee. As David mentioned, as Dawn mentioned, David Warmold currently is the chair of our steering committee. So these were the focus of each of the work streams. Workstream A focused on access, availability, and integration of geriatric services, inclusive of geriatric medicine, geriatric mental health, and psychiatry right across our region. Workstream B looked at linkages, coordination, and navigation, and really trying to, we heard the voices of our older adults of really the navigation system proved to be challenging. So how could we best make it as easy and seamless as possible? So workstream B, that was the focus. And Workstream C, equity, diversity, and inclusion. In each of these areas, we are still focused on and still are the primary areas. What we have recognized is that each area overlaps with workstream A, B, and C. So we have continued with working groups and have representation from each of the work streams now and really move them into specific work groups versus specifically aligned with the work stream. So the year, the older adult functions, and since its inception and throughout the COVID-19 pandemic, and the COVID-19 pandemic allowed us starting back in last March, the older adult strategy served as a catalyst, connector, convener, broker, influencer, enabler, and collaborative partner. And we had the platform when COVID-19 hit our community, hit our whole world. We were able to move and really address the areas that were impacted our older adults within our community by the work of the older adult. We had the platform, we had the working groups, and we were able to pivot very easily to really look at how we can best support and still address those areas of access and navigation, equity, diversity, and inclusion. So the year one implementation summary report, as Dawn said, you'll get these slides, and when you click on that there, when you have the slide, it will take you to a link where you will be able to access all of the year one workstream reports and the achievements, the impacts, and there is a summary of how we're moving forward into our year two. I'll turn it back over to Dawn. Thank you.
Okay, Jane, thanks very much. Important in this work, and since the very inception of the Ontario Health teams, we've been deeply engaged in helping to inform that work and support the teams that are leading the applications, the submissions, and the implementation of the Ontario Health teams across Waterloo Wellington. So we thought it was important to articulate, what does that mean? How is it that the older adult strategy is working with our local Ontario Health teams? Well, we've been working to advance priority population planning, implementation, and evaluation in the following ways: by leveraging subject matter expertise at the system and service delivery levels. So often we'll broker the engagement of people with subject matter expertise when needed. We work to harness momentum on areas of shared priorities with each of the OHTs, understanding that there are differences therein. We're working to align with ongoing projects and future or planned initiatives to make sure that we're aligned and we're supporting and not duplicating, not replicating, and not certainly working in concert with each other. We work to adopt, adapt, and/or build on informed recommendations flowing from the business cases, briefing notes, and other outputs that Jane mentioned earlier from the year one implementation. And of course, we're working to develop integrated work plans on initiatives where it makes sense to do so. So we meet with the transformational leads from each of the Ontario Health teams on a monthly basis, and that is a meeting that is viewed to be of high value by all stakeholders. I'll now talk a little bit about our phase 2 implementation. So the phase 2 action agenda is what we're calling it. It was informed in part through our year one evaluation, and then a series of priority setting exercises that followed: surveys, consultations, discussions, and dialogues with people in the field. And that happened really over the course of December, January, and February. It was important for us to look at the input on structural and process considerations offered by members as they reflected on the phase 1 of our implementation work. We continue to seek to identify existing tables or working groups or networks where possible to engage and action elements identified in our 5 priorities that you'll hear about soon, knowing that it's not necessary to recreate or to strike a new group or a new committee all the time. In certain instances it is, but there are many groups that currently exist through which we can look to partner and collaborate on to do the work. As Jane mentioned, the older adult strategy doesn't lead everything it does. It does this in collaboration with others in the community, and we're thankful to all of those partners who are so engaged. And we're using, as Jane also mentions, project teams and reference groups as we move forward. Also supported by the implementation team, that would be ourselves. Those are the key mechanisms we're using to mobilize the action agenda. So this is the framework, a very busy slide, but I'll talk with you very briefly, talk you through this. This is our the framework for, or the placemat for our action agenda. You can see in the top row in the light green, we reference the goals, then the longstanding goals of the strategy, the priority pillars, and the enablers. Off to the right in the dark green section are the health system functions we typically look at when we're thinking about supporting older adults or supporting an aging population. These are promoting and supporting healthy aging, firstly, preventing and managing chronic disease, promoting optimal aging at home for older adults with chronic conditions, providing specialized care for those living with frailty, and of course, supporting caregivers. So we're always focused on those health system functions. Excuse me. We were mindful, if you look down to the next section where you see the red moving to blue, we were mindful of the context we're currently sitting in and knowing that we can't be certain about timelines as they relate to COVID-19 pandemic response and COVID-19 pandemic recovery, and then what post-pandemic life will look like. But we do have ourselves some flexibility and some fluidity as this continues to unfold. We talked then about the priorities, the 5 priorities outlined in the action agenda, which we'll go through in great detail in the following slides. Also anchored on the quadruple aim, as Jane mentions. And this, for those who may not be aware, who are new joining us, who are public members, I will just give a very brief overview of that. So no longer is it appropriate to base decisions on programs or policies or services on any one particular factor. It's not acceptable to do something because it's the cheapest and it will save the system money for obvious reasons. It may have unintentional consequences in other areas. So too, is it not appropriate to do something because it will promote the best health outcomes possible, because it may not be affordable. So the quadruple aim asks us to check 4 areas in all decisions. Does it provide better health outcomes for people? Does it provide a better experience, a better care experience for people? Does it provide better value for money? And does it provide a better experience for those working within the system to provide care and a greater sense of empowerment and joy in their work as they do that? We also looked and have implemented an integration framework that's been very helpful in normalizing discussions about integration, what that means, what level are we talking about for integration. It doesn't necessarily and should never represent discussions solely about organizational mergers or system redesign. It can be, there are lighter ways of approaching implementation in the early phases of work. So I'll turn it back over to Jane to talk about the first 2 of the 5 priorities outlined in our phase 2 action agenda.
Thank you, Dawn. So the first one, developing and implementing an integrated service delivery models. This is really speaking to areas that have been identified throughout the older adult strategy and by our partners. It was recognized throughout COVID-19 that access to primary care and retirement homes is an area that looking at how we can improve and look at an integrated service model. And then we have the integrated geriatric psychiatry and mental health team, and really looking at how best we can integrate the services within our region and build on partners. We, in these areas related to both geriatric medicine and geriatric psychiatry, have limited resources. Specifically within geriatric medicine, we don't have base funding. So therefore, really looking at how can we maximize our partners, continue to request when the opportunity presents itself for base funding to support the geriatric medicine model. And inclusive in that is the inpatient geriatric medicine. We look at that the continuity of care is very important in order to have a successful integrated service delivery model. So starting with the primary care, access to primary care, access to the specialists, access to inpatient resources when required, and that the specialist would be available within inpatient to serve older adults. So really looking at that continuum of care, and the destination may be to retirement home, maybe to long-term care, and or maybe returning back into their own individual home setting. We've also recognized in order to have a strong service delivery model, we need to continually be looking at sustainability and recruitment of geriatric specialists. So we are working with leaders in each of the organizations throughout acute care and within the geriatric specialty groups as well, and including the Canadian Mental Health Association to look at how best to recruit geriatric specialists to our area. And then we have the Waterloo Wellington Intake Network, which is our partners who have come together, and this includes partners that serve beyond older adults, but older adults are inclusive, and really looking at what can we learn from our partners, how can we better integrate, and how can we really listen to the voice of the older adult to ensure that they're not having to share their information over and over, depending which door they enter. So really working together with that group, and it's and looking at how we can better serve people in our community. This is an example of the model that we're really striving to work towards. I would call it a living document. As you can see, in the center is the person and family. So that would be our older adult and their family. And next is primary care and OHT teams, and really looking at that as a foundation of within the care of older adults, that is the core. And then looking at how we as partners can really partner with the person and their family and primary care to serve as best as possible. So on the left, you can see in the green, the clinical resources. So really looking at how we work with our geriatric specialists, both geriatric medicine, geriatric psychiatry, nurse practitioners, the clinical intake system we have, our intensive geriatric service workers, looking at home and community care, memory clinic, and Geri MedRisk, and how we all work as a partner. Then on the right-hand side, you can see the program supports, which include health and information management. We are currently within specialized geriatrics increasing the access to caseworks, where we have both geriatric medicine and geriatric psychiatry in specific regions accessing caseworks, which is a platform that holds the data and clinical information for the older adults serving, so people can see what different partners and when different partners are participating in the care of an older adult. And then the clerical and IT is pivotal and foundational in how services are delivered. At the top, you can see the importance of our system level, which really speaks to the work of our older adult strategy, and recognize the accountability that we really, as we move and transition into OHTs, looking at the accountability and where does accountability live and be accountable for within our various partners. And at the bottom of the green circle, you can see where we have the provincially funded and regional programs that we partner with, our GEM nurses, nurse-led outreach, behavioral supports, psychogeriatric resource consultants, community support services, and paramedicine, and really trying to look at a senior-friendly care team, really looking at, is this an opportunity to really look at having a provincial senior-friendly care team that really speaks and has the core values of senior-friendly care. The boxes on each outside is where our OHTs are, and just to demonstrate the collaborative and working together with each of our OHTs, and then each has, as well as their acute care sites. And as you can see, the base of it, looking at really a goal is having smooth care transitions, be it to home, long-term care, retirement home, wherever that destination is. Maybe it's hospice as well, and really trying to look at how best we can assist with transitions. In addition, really looking at how we can support frontline providers through early on, when COVID-19 hit, we realized that frontline workers having to work from home, really being able to connect with partners, which you may see in the hallways of retirement homes, you may see within the office building you are in, and you may also share space with community partners. That when people started to have to work from home, we really recognize the importance of bringing frontline workers together. So we developed an older adult community service hub, and we have really excellent participation. It really brings the frontline people together to look at what's changing, what services are available. We've had leaders both from public health, the non-hospital COVID table present, really trying to keep people informed in a timely manner. And out of that, those meetings were initially happening every 2 weeks, but we have moved to leaders within our communities, leading communities of practice within each region, which really speaks to the clinical care of older adults. So our hub speaks to the system and changes within the system, and the community of practices are co-chaired by leaders in the community who are really trying to address some of the challenges related to clinical care. And then the areas of that we really have looked at as far as practice development support is relating to frailty, the impact of virtual care, even looking at and working with our partners across Ontario West about when is virtual care appropriate and when would face-to-face be more appropriate. Then we're looking at also, as we move forward in year 2, a palliative approach to care across the whole system. And then our work within our knowledge exchange in geriatrics is really geared towards supporting frontline providers. Don and his team have really led an excellent Lunch and Learn series and webinars like today, really sharing with our frontline workers as well. And in addition, we have a strong partnership with the Regional Geriatric Program Central, which Waterloo Wellington is part of, and in collaboration with McMaster University, the Knowledge Exchange and our eFrailty modules are all part of the Geriatric Certificate Program.
Thank you, Jane. I'll take us through priorities 3, 4, and 5. So our third priority is supporting older adults at risk. Some of you may have seen in the newspaper or heard on the news last June, or seen on TV or heard on the radio about the Stay Safe, Lead the Way campaign that we initiated during the week of April the 7th, 2020. We continue on with this campaign, and it's expanding, and it's meant to reach out to older adults who might be at risk of social isolation, loneliness, and premature frailty, community dwelling older adults. We'll talk more about that later. We've launched the Waterloo Wellington Supporting Older Adults at Risk Collaborative, which is a group of people and service providers who do work in this area, in this field, that is seeking to advance a shared and common agenda where possible across Waterloo Wellington. So that group is to be struck and formalized at the end of this month. In the meantime, we've been working with the Supporting Older Adults Grant-Funded Initiatives Working Group to mobilize some grant funding that we received from the United Ways in both Guelph, Wellington, Dufferin, and Waterloo Region communities. And we'll talk more about each of these projects, or certainly the My Wellness Calendar project coming later. Waterloo Wellington Neighbours is rolling out across Waterloo Wellington. It is a project based on the gatekeeper model that's been around for many years, that's meant to look out for our neighbors, look out for one another. We've rebranded it through partnerships, the Waterloo Wellington Neighbours Program. And it's meant to prepare community members, people living, lay people living in our community with the skills and knowledge that they need to identify an older adult who might be at risk, or who may be decompensating or struggling, and help to identify them and link them to services that might be of use to them. We're also working to roll out a series of webinars and education sessions on compassion fatigue for caregivers, for home caregivers. And we have our next session coming up next week. Talk more about that and the efforts we're putting in place around substance use and harm reduction as it relates to older adults. We have an editorial that's out in the papers this week, you might see, that we've put together with our working group. and I think Liz will speak with us more about this later. We're working to strengthen our emphasis on diversity, equity, and inclusion. We'll talk about that a little more, and supporting the expansion of community paramedicine programs, such as the remote patient monitoring project, and the new project that's been funded to support older adults awaiting long-term care placement in their homes while they're waiting, so they don't decompensate or become so they don't develop frailty any further. Priority action item number 4 is engaging and supporting older adults in general and caregivers in general. We've established the community member forum, which Liz will talk to in a little while. We've had some great outreach and engagement with the Age Friendly Communities Network. This is a group of older adults who are actively pursuing certain priorities to create age-friendly communities. You'll hear about the next opportunity in a little bit in a more formal way, a direct ask related to the Waterloo Wellington Older Adult Network, which we're launching this month. We're participating in a series of research projects as stakeholders, such as the Supporting Inclusion Through Intergenerational Partnerships funded program, funded by New Horizons. And this is being led by the Research Institute for Aging. So a series of projects that help to build partnerships between older adults and younger people, and all of the benefits that you can imagine might be derived from that. We're also participating in, as a stakeholder in the co-designing dementia diagnosis and post-diagnosis care called Cognizance. One of the co-investigators for this project, it's an international project, is Dr. Carrie McKinnon. We're working closely with her to help support the rollout of a campaign and a toolkit that will help people who are diagnosed with dementia at the point of diagnosis and thereafter with the tools and communication tools that they'll need to take a positive spin on what that diagnosis might mean. So we know that these sorts of diagnoses can be conveyed or shared in a way that is quite stark, and it's hard to find hope in some of those communications. So they're working hard to change that. We continue to host the social learning platform on Facebook, Caregiver Community Connections, Waterloo Wellington. This is a place for people who are caring for someone, who are working caregivers who are caring for someone at home or in their lives. We're working with St. John Ambulance to support the rollout of the Home Caregiver Support Program. This is what we heard from older adults and caregivers over the course of our consultations, that people need to know how and what to do when they're caring for someone in their home, whether it be a husband taking care of his wife, vice versa, or a dependent taking care of a parent. They need practical skills. They need to be shown in a practical, real-world way how to do some of the things that they're going to need to do at home, and feel confident about providing that care and competent in providing that care. We're working closely with psychosocial and spiritual supports group here in Waterloo Region to think about messaging related to grief and loss and how we are going to support each other once the pandemic closes. Number 5, our priority action item is, obviously, you've heard a little bit about this, supporting health system transformation at provincial and local levels. We've talked about our work with the local Ontario health teams, how we're deeply engaged, especially in the Kitchener, Waterloo, Wellington, Wellesley, Wilmot, KW4 area, given their emphasis on frail elderly as a priority population in year 1. So we work very closely with the co-chairs and working group to inform that work as it goes forward and co-lead some of that work. We are also involved in some region-wide improvement projects that I won't really go into, and our work with colleagues across Ontario Health West, so Niagara to London, Hamilton. We work closely. We've taken a lead at bringing those groups together. These are people that do work similar to us, seeing how we can help each other, how we can be of benefit to one another, how we can build on successes we're each experiencing, how we can share resources. So we're delighted that that is happening. And of course, our work with the Provincial Geriatric Leadership Office, we're closely linked with them, and going to be launching the local instance of the asset mapping exercise that will happen later this month. So trying to get a better understanding of how many people are being seen, through which services, and how are those services resourced. This helps us from a needs-based planning perspective, thinking about what might be needed in the future and how to better prepare the system to respond. Finally, I'd just like to mention how we're working to intensify our external communications related to the strategy, and some of the vehicles that we're using or mechanisms that we're using. So today's webinar is one example. Earlier this week, a bulletin went out, a little longer than 2 pages, but it was meant to inform folks on what's going on in our area as it relates to older adults, and we put a special feature together for Seniors Month. We have public webinars that are happening. So those are the next 3 that are coming this month. Today is the update webinar. We have lunch and learns coming out. These are directed at service providers or frontline providers. The knowledge exchange, you'll hear about this. You've heard a little bit about it, but I think Liz will talk about it as well. We are active on Twitter right now. We're engaging through that vehicle, and really happy to be doing so. Please follow us at WWOAS to be kept abreast of what's new and going on with the older adult strategy. And I mentioned the Caregiver Connections Waterloo Wellbeing Facebook page. So now we must really emphasize the importance of community and member engagement in the work that we do. So I'd like to introduce Liz McKinnon to come and speak with us a little bit about her participation and experience with the Waterloo Wellington Older Adult Strategy. Liz.
Good morning, everyone. It's a treat for me to participate in this session today. I have had gained such value from my participation in the the development of the older adult strategy. First of all, as a member of the community forum, or the community member forum as it's called, we had many opportunities to come together as a group. Each of us had participated in one of the streams of the work being done on the older adult strategy. There's a picture of most of us, not everyone is there, but there we are in beautiful Elora. It was so good to know that our input is highly valued. Our wealth of experience and wisdom gained from our years of life certainly was welcomed into the work we did in the individual streams, and 2 of our members were part of the steering committee for the older adult strategy. It was the community member forum was launched with the intent to provide opportunities for community members to think about the roles we've played and how we might take our collective influence in the work and leverage that to add value. We were able to share information with each other about the work we were involved with in the work streams and the steering committee. We could share our stories and experiences and consider how these could inform the work going forward. We learned more about the health system, certainly a great deal about the health system and the current priorities. We were able to give our voice in many avenues, and we could hear from those representing specific sectors and services, adding to our own knowledge. We knew our role was appreciated as contributors to the co-design of this health system transformation. We were able to feel comfortable and confident and engaged in conversations with a broad range of stakeholders. And most importantly for me, we derive value and meaning in our own lives through participating. This volunteer participation adds such dimension to our lives, all of us as retirees. It wasn't just our own sense that we were gaining value from this, but evidence was gathered using the public and patient engagement and evaluation tool, the PPEAT. It's a survey questionnaire that was originally developed by Dr. Julia Abelson at McMaster, and that indicated that introducing the community member forum made a positive difference with respect to how participants viewed their involvement and engagement in the Waterloo Wellington older adult strategy. The contributions from community members has been of great value, not only demonstrated by our saying so, but by using this evaluation tool. Our efforts and our ideas were important in the co-design and the implementation of the Stay Safe, Lead the Way campaign. That too was an interesting project to be involved with. And the development of resources to support healthy community living. So that talks about the community member forum. And again, I want to add how much it meant to those of us who participated as patient, family, caregiver participants in that. Another area we were involved with was in the education and knowledge exchange. One of them, substance use and harm reduction, I had the opportunity to facilitate and be master of ceremonies. It was a webinar, and that was another learning experience. So as a former educator, post-secondary educator, I'm a great believer in lifelong learning. And these webinars are providing lifelong learning for our population, or contributing to lifelong learning, and also to the my personal lifelong learning. I had never chaired a webinar, so it was something new. The one I facilitated was regarding alcohol use and cannabis use. There were two sequential sessions. The older adults' use of substance and harm reduction options was the topic. In last year's forum, we had experts in the field of older adult substance use and harm reduction, including older adults with lived experience, a geriatric psychiatrist, a pharmacist, an outreach addiction specialist, and they all shared their knowledge through this online virtual webinar. It was very, very interesting. So in this field, we recognize that older adults may use alcohol and cannabis in social situations and to relax, and often they may enjoy the effects of these substances while they are alone or socializing with others. And in small doses, they may be helpful. In larger doses, or used too frequently, they are not. And we learned about these boundaries in last year's webinar, and we'll continue to bring this information and evidence-informed practices forward in future work this coming year. Secondly, we continue to be in the midst of a pandemic, although COVID-19 diagnosis numbers are decreasing, but social isolation, loneliness, anxiety, and reduced access to loved ones and recreational outlets are all risk factors for substance use. We know that LCBO sales have increased by 25% since the beginning of the pandemic, and that new cannabis outlets are opening in our community. So it's timely to look at identifying the sweet spot for alcohol consumption so that we don't put our health and well-being at risk. Our work in this area continues through the Older Adults Substance Use and Harm Reduction Working Group. You may have seen an editorial this week in a number of the free weekly newspapers, and Dawn alluded to that earlier. The Waterloo Wellington Annual Knowledge Exchange was held on December 16th, 2020, with over 110 healthcare and community service providers, older adults, family members and caregivers who came together for the first virtual instance of this annual knowledge exchange in geriatrics. Hindsight is 2020. That was the title of it, Caring Through COVID-19. Together, we demonstrated our commitment to and the value of coming together as a local learning health system to demonstrate reflection, sharing, growth, and adaptation through the COVID-19 pandemic. On that day, we learned how to build more empowered health teams by sharing experiences, opportunities, and resources to target the risks associated with isolation or to improve the care of those facing it during the COVID-19 pandemic. We reflected on the diverse personal life experiences of older adults and how they faced and overcame adversity to better understanding, coping, and resiliency. We developed self-care practices and techniques to strengthen the mind, body, and soul to build personal and professional resilience and improve our capacity to take care of ourselves. We broadened our professional networks to strengthen our relationships with others who work to improve the quality of life of older adults. I had the pleasure of hosting the session on sharing and profiling exemplary programs, services, and initiative that included music therapy, and it was very interesting. And I wasn't the only member of the older adult community member forum. There were others who, at least one other, who co-facilitated one of those sessions. So our engagement is important to the strategy in the past and going forward, and has been a very welcome part of our lives through this past year and even further back. And I'm very grateful to Dawn and Jane for opportunities to continue participating. Thank you.
Well, amen to that, Liz. Really well done. And of course, it's our absolute pleasure to involve people in a true, authentic way. We know that the power differentials in healthcare are shifting, and for all the right reasons. Person-centered care is part of that, but so too is having voice in creating and supporting the development and informing the development to ensure that the end user is receiving care, services, and supports that mean something to them. So thank you, Liz, for all that you do. You're a champion for the strategy and your community, and we salute you today during Seniors Month.
Thank you.
I'd like to build on the Stay Safe, Lead the Way campaign that Liz mentioned, that was so very much improved and relied deeply on the voice of older adults themselves. So I told you that we launched the campaign in April of last year, and we've been running weekly with partners, strong partners such as Helen Edwards and Kathy Harrington. We've ran this campaign weekly and we ramped up our campaign in January of this year to be more expansive across Waterloo Wellington. We've collaborated with our Ontario Health West partners to run ads in Hamilton, St. Catharines, Wellington, in conjunction with the Hamilton Council on Aging. And we're doing so again this month in celebration of Seniors Month. So weekly ads in conjunction with our partners. I should say that some of the materials and content created through these ads has been used to develop 5 double-sided flyers that have been printed and distributed. Over 38,000 or nearly 38,000 copies of these flyers. And some posters have been printed and distributed through community service providers and others. And we're so thankful for those helping to get this information into the hands of those who need it. I'm keeping an eye on our question and answers, and I noticed that we don't have any yet, but we would like to leave some room for some time for that discussion. So please, if you have questions, do enter them into the question and answer field. Here are examples of the flyers that were created. On one side of each of the 5 flyers, we had information that was related to COVID-19 and how to support people in what they might be experiencing through the pandemic. Trying to be safe, encouraging them to be safe, giving them information on who they should call if they need help, providing health information to support health literacy, providing some information that could lead to a decision support for people on how they were acting and practicing in their own communities, supporting them through their grief and loss, which we know many people were coping with a great deal of grief and loss, or were not coping well with that. So on one side of the flyer, we had messages specific to COVID-19. On the other side of the flyer, of each of the flyers, we had messages related to healthy aging and what we could do to stay healthy and well while we were all at home over these many, many months. I'd like to now talk about another project that we worked on, and this was with funding from the United Way, Waterloo Wellington Dufferin. It's called My Wellness Calendar, and it's just been released. So that's the front page of the calendar. And this calendar was really put together to help older adults monitor and record on a daily basis how they were feeling in order to help them be mindful of preventing the onset or progression of frailty. It was meant to engage them in reflection on and being mindful of factors that lead to higher or lower levels of self-reported well-being, to help them make informed choices about activities such as nutrition, mobility, medication, sleep, and behaviors, reaching out for help when they need it and being encouraged to do so, even during a pandemic, and staying connected with one another. It was also important that they knew who to call when they needed something. So I'm going to show you a few and give them access to credible health information and health literacy. So I'd like to show you a little bit of this. This is how older adults were, community dwelling older adults were encouraged to track their health over the course of a month. The calendar runs from April 1st, 2021 through to December 31st, 2022. So over 18 months in the calendar. So people were asked to chart on this grid every day their answer to the question, in general, how would you rate your health today? The beginning of the calendar has a place for people to create a personal health profile. It's 2 pages. This is one example of a page. And then each page, as it's flipped, has a top and a bottom. On the top, there's information and artwork that's all been curated from local older adults in Waterloo Wellington Dufferin, all included in this calendar. And then some puzzles or some activation exercises, some poems, some quotes, some health information here. In this case, June is Seniors Month, and the importance of reducing ageism in our community was something we wanted to share. Then you can see how the calendar itself is presented once the calendar is opened up underneath that page. So a typical calendar with all sorts of different religious holidays, and important days that matter to many communities. And people were encouraged, if they didn't know what that meant, if they've never heard of that holiday, to look it up and learn more about it. So you can see the tracking on the bottom. And you can imagine if you were a son or a daughter going into your parents' home and they were using this tool and they'd been doing very well at the beginning of the month and maybe had started to decline, you would see that and it might lead to a conversation. Hey, Mom, what's been going on? I noticed that you were reporting your health or you were feeling better earlier this month than you are now. Here's the phone directory we mentioned at the back of the calendar. If people need X, they should contact Y. All of the information is localized in Waterloo Wellington Dufferin. And there's great interest in replicating this and adapting it for Waterloo region and many of the municipalities. So we did not do this work. We did not lead exclusively this work. We wrote the grant and brought the money to the group, and we were able to mobilize this, and much of it was led through CMHA, but you can see the many partners here. It was led by an implementation working group that was supported by a steering committee. So I'd like to now just further our conversation a little bit with the community member engagement. How do we move forward with deepening and extending that engagement? Really excited about this. So this month we're launching the Waterloo Wellington Older Adult Network. Think of this as the community member forum that Liz talked about, which is exclusive to work on the strategy, but beyond. So it's our idea to develop a cadre or a network of older adults who are interested and can be available to bring diverse perspectives to work being led by organizations across Waterloo Wellington. So these may be people who are interested in participating in research or improvement projects, or be interested in participating and available for consultations if they're called. Any co-design projects being led by the strategy or the Ontario Health teams or any other organization looking for older adults to participate could come to this network. This group may have expertise and subject matter expertise and interest in holding a speakers bureau, so a listing of people who are interested in speaking on matters that are important to them. And obviously, this is all with a view to increase the extent to which we're engaging in the building of diversity, equity, and inclusion in our community. So I'll invite, this is a bit of a call to action, invite this group, as you've been so helpful before, to please put forward any names of individuals that you feel might like to be involved in this, or you yourself. So this ends our presentation. We have a very few minutes left for questions, and I think we do have one. Can you please talk further on how older adult people of color are being engaged? I know for a fact that this segment is very shy and not outward going in nature, is the question. Are mosques, temples, etc. engaged, or resources diverted towards them? That's an excellent question. I think I did just speak a little bit about our intentions to try and be more diverse in our outreach and engagement, or broader in our tactics for outreach and engagement. We do have, I can mention the flyers that you saw are currently, we've put them forward for translation into 2 languages that are other than English, and they're not French either. We want to work with Entité, our local provincial health French language support service, to look at translating those documents into French, but we're also working with a group in Guelph that supports immigrant services to translate the documents into the two most popular, I guess, they're the 2 most prevalent languages outside of English and French in our area. But I would encourage the person who's asking the question to please do be in touch, because we'd be very interested in learning about any ways that you think that could be done in a meaningful way and an authentic way with the groups you mentioned. So thank you very much for your question. I see no further questions, but I thank you for that. And you please do reach out at any time. As we approach the end of the hour, I'd just like to remind you that we're hosting these every week, as I mentioned, so please do join us again. Next week, we'll be hosting, in collaboration with the Mental Health Association of Waterloo Wellington, a session on compassion fatigue. This is for older adults and caregivers especially, so you won't want to miss this. The following week, so they're every Wednesday from 11 to 12, just like now, we're having a session on healthy aging. Small steps lead to great rewards. We'll be covering topics such as the 24-hour movement guideline, healthy eating, sleep, and activity. So that's a great one to be at as well, or encourage your friends or parents to attend. Finally, we'll punctuate the series with protecting and empowering older adults at risk. This will be in collaboration with the Elder Abuse Prevention Council. We'll talk about elder abuse among other risks facing older adults. And a reminder that World Elder Abuse Awareness Day happens on June 15th. So before I turn it over to Jane to close us out, I'd just like to let you know what will happen following this presentation. You'll receive a recording, a link to the recording or to the video of today's session. You'll receive a copy of the presentation slides with active hyperlinks for you to click on. We'll also include a few other resources for you, such as our bulletin produced for Seniors Month. And then you'll also receive a link to a survey, short survey, just to let us know how we did today, what you'd like to see more or less of, and what parts of this presentation you most enjoyed, and who you are and where you came from and how you came to be here today. So we'll leave it at that, and I'll welcome my colleague Jane back to close us out.
Thank you, Dawn, and thank you, Liz and Giselle. And I just, in celebration of Seniors Month, just really want to take this opportunity to thank each one of you for taking time today to participate and hear the wonderful work that's happening. Many of you on the line are part of this, I'm thinking, and really just want to thank our community. Special thanks to Liz McKinnon today for coming and sharing her experiences representing the Community Member Forum and just the excellent work and leadership Liz has provided in our community and continues to provide, and many of our older adults within that Community Member Forum. Special thank you to Giselle Loyola, who's our moderator and is behind the scenes. And without Giselle, this would not be taking place. She does a lot of work prior to the event, and her expertise and knowledge and leadership we really appreciate. I also want to thank Dawn. I think many of us know Dawn has led and been the implementation facilitator to get us to where we are today, has engaged many, many community partners and partners that are new to us to work with, which we're very thankful for, and with the older adults. So thank you to Dawn for leading us today and bringing us all together, and for the work he's doing in ensuring that Seniors Month is well celebrated, and his leadership of the webinars and the team that he's working with. So wanting to wish you all a great day. And I just want to end with, on the calendar for Seniors Month, there's always a quote. And the quote for June in the calendar for the wellness calendar is, "Come grow old with me. The best is yet to be," by Wordsworth. And just an excellent quote included in the June Seniors Month and in celebration. So thank you all. And we really thank all our older adults, because we are where we are today because of their legacy. So thank you.
Thank you, Jane. Thank you, everyone. Stay safe.